Welcome to the Therapist Thrival Guide. My name is Miranda Barker. I'm a licensed clinical social worker. And with me is not Lucas Vellini, but in fact, Kelly Pieper. Kelly, do you want to introduce yourself?
Sure. My name is Kelly Pieper. I am a clinician and the director of our Children's Services Department here at LE Mental Health.
What's your license?
LICSW.
Okay.
Clinical social worker.
I forgot that you were also a clinical social worker.
I am.
It is, I feel like this crowd is usually dominated by LMFTs. And so happy to have a fellow clinical social worker here.
Absolutely. I love it.
Awesome. And what clinic do you work out of?
I work primarily out of the Minneapolis clinic in Northeast.
Okay. Awesome. I still have never been to that clinic, actually.
It's cool.
I know.
It's got a good vibe.
I'm a Minneapolis gal, and so I can't believe I haven't been to that clinic.
It's nice.
Yet.
Our assessment clinic is there too now.
Yes.
Yeah.
Okay, wait. Do you want to just talk a little bit about that really briefly?
Sure. So we used to do psychological evaluations out of our Minneapolis clinic, and now we have a much more tailored space. It is still in the Minneapolis clinic, but it has its own sort of space and suite set up that's much more evaluation friendly, much more quiet, much more controlled. And then we do evaluations for kids and then some adult evaluations as well there now, and kind of are expanding that program.
What sort of evaluations?
So when we talk about evaluations, we evaluate for things that therapists may not have the expertise to evaluate for, things like autism spectrum disorder, ADHD, and then some of the trickier kind of differential things when we're not sure exactly what's going on, but we feel like there's more to this picture and we need some testing to support our understanding of what might be most helpful.
Yeah, awesome. And our guest today is Dr. Claire Garber. Do you want to introduce yourself a little bit?
Yeah, I'm Claire Garber. I'm a child and adolescent psychiatrist. I also work out of the Minneapolis clinic.
Oh, so wait a second. So when we came in here and I was like, "Do you two know each other?" and you both were like, "Yes, Miranda."
Yes, we know each other.
Oh, perfect. Okay, so wait, sorry, keep going.
So I see kids kind of the whole spectrum into young adulthood, and primarily do medication management, and
Awesome. How long have you been in this field?
Let's see, I've been out of my residency and fellowship for like 4.5 years. So I've been practicing for about that long.
Awesome. So, and have you been at Ellie that whole time?
I've been at Ellie for about 1.5 years.
Okay, nice.
Yeah.
Well, awesome.
Yeah.
So today we're talking about autism spectrum disorder, and I wanted to bring our medication management team and our child therapist team together to talk a little bit about how, what the symptoms are, how to best treat this, all of this sort of thing. And so I'm excited to kind of dive in. Mm-hmm. I don't know who wants to start with what are general symptoms of autism spectrum disorder? And to caveat, we're talking mostly about kids today. Yeah.
Yes. Sounds good.
That's good because that's what we do.
Perfect.
Yeah. I'd be a little shocked if they were like, let's talk about adults. I'm like, I don't know, not my area. Symptoms with kids. Autism spectrum is a spectrum, right? That's why we name it as such. It has a ton of different symptoms that can go along with it. It's really a cluster of symptoms that are kind of lumped under the same kind of umbrella. So when we have this cluster of symptoms, we understand it to be autism spectrum disorder. There is a wide range of functioning, and I think that is sometimes a common misperception among people, is that it has to look like one thing or it has to be very severe. We see incredibly well-adjusted, really super functional kids doing just fine who qualify for the diagnosis. But essentially, I think the main feature when I think about it, autism is some sort of social deficit. So it really impacts our ability to perceive ourselves and other people in a way that is neurotypical. So there's a lot of, I think neurodivergence is like a buzzword, but right now thinking about, neurodivergence as being a difference in the way that your brain works. And so For ASD, the difference in the way the brain works has a lot to do with social things, social skills, social perception. There can also be a cluster of other symptoms that may or may not go with that. Sensory sensitivities and reactivities, sensory aversion, sensory seeking, meaning that we have to have a lot of sensory input in our body. Some rigidity, so having to have the same kinds of routines, the same kinds of things. Fixed interest, where we get super intensely, passionately interested in one thing, to the detriment of kind of some of those other social skills, or kind of existing in kind of the neurotypical world. So there's a whole bunch of things that can really be sort of lumped under that we look at when we're looking at evaluating for autism spectrum disorder.
Awesome. Do you have anything else to add with that?
Kelly did a great job.
Kelly, you're awesome. Yeah. So I'm curious, what do you two love about working with this population and with kids that are on the autism spectrum?
Yeah, I mean, I would say just kind of piggyback on the idea of this spectrum, right? Like, they're all unique. So, you know, what you're working on with one specific kid is really individual. So, you know, whether or not they have autism, like, you approach them as a unique person and figure out what their individual challenges are and, you know, come up with goals and things together. And so I think, you know, it's important to kind of understand the child in that context, but also, you know, really looking at it with like their unique sort of challenges and strengths. And
yeah. So if I'm a new clinician and I just started working with a kiddo that I suspect is on the autism spectrum, what would be my next kind of course of action or step? Would it be additional testing? What would it look like?
I typically recommend testing. I think that's a good way to get a pretty thorough picture overall just of kind of cognitive process and functioning. And I think the thing that we always think about with testing is a diagnosis of. And what I really like about testing is it helps you understand the way a kiddo's brain works. And so it isn't just about those areas of deficit, it's about the areas of strength and what we can capture to help kids function really well and get to know their strengths and advocate for their strengths, while understanding that they may have some areas that are going to pose additional challenge for them. And we can help work with them around those challenge areas. So I typically recommend an evaluation with a clinician, a psychologist who's very familiar with diagnosing autism in kids. I think that tends to be the best way to kind of get started.
Okay. And then what about after that? You've received an autism diagnosis. What does treatment of symptoms, or what does this look like for, we'll start with the therapist side and then kind of moving into medication management?
Yeah, so one thing that I really, really emphasize to families and to kids, because I think it's so important for kids to hear, is that autism doesn't mean that your brain is broken. It doesn't mean that there's something wrong with you. I don't like the perspective of necessarily treating the autism. I like treating the symptoms that create distress around autism. So, you know, sometimes kids can have anxiety or they can have depression because they don't understand why they're not making social relationships and they really want those social relationships, or they don't understand or get very anxious when they can't do something the way that they expect because their brain is programmed that way. And so it isn't about curing or treating the autism. We're not going to get rid of that. We're not going to change that about their brain. But we are going to support them to use their strengths, to advocate for their strengths, and for their parents to advocate for their strengths, while trying to support some of the resulting kind of symptoms that might create that distress. We aren't living in a particularly like neurodiverse friendly world. Like, we like to have a very specific way of doing things. And I think it's really easy for kids to develop the idea that their brain works wrong or that something is wrong with them. And so I really, really try to understand and come at it from this perspective with parents too, of like, there is absolutely nothing wrong with the way that your child's brain works. Where there's deficit, there's also incredible strength in some of that passionate restricted interest or the the creativity in the way that they can sometimes just interpret different things in different ways. So it's really about kind of, I think, finding a good fit for therapy to support the strengths and some of those areas that are creating distress. And therapists who can advocate to school. I think school is a big part of the picture in helping kids feel successful.
Yeah. So tell me about some of like your favorite interventions, like if a kiddo is struggling with social skills or, maybe we just start with that.
Yeah, I mean, so I think the biggest thing for me is kind of like what Dr. Garber was saying is finding out this unique individual, right? Because every kid is going to have a little bit different perception. Everybody's going to have a little bit different understanding of what's happening. And so trying to find those distress points, like, okay, so you're having some social difficulty. Where is that? Sometimes when we have that anxiety, and this is true for kids on the spectrum and not on the spectrum, but when we have that anxiety, sometimes our boundaries can get blurred. And so instead of, approaching people in a way that feels good for them, we're in their face or we're in their space or we're touching them. And so if that's an area that creates distress and anxiety, then we start kind of supporting kids to recognize and to realize, but also to explain why they're coming at the world differently. Because I think a big part of it is helping kids find acceptance for themselves and helping other people accept that their brain works differently. So it doesn't mean that I have to be okay with a kid like climbing on top of me, right? I get to have my boundaries and my body boundaries, but helping kids be able to say, this is the way that like I interact with people at first when I get anxious or when I don't know what to do. And then helping people pause and kids pause and reset and then try again and kind of navigate some of those social situations. So a lot of it depends on those distress points. Like how can we use your strengths, your desire for social connection, your super smart brain that learns so well to really capitalize on those strengths and decrease the distress around any given area that might be creating some difficulty.
What are some other like distressing points or some things that you might work on with a kiddo on the spectrum?
Oh my gosh, there's so many. It so depends on things. And I think a lot of times it's not necessarily the child themselves, it's how the neurotypical world is relating to the child, right?
That's such a good point.
And even parents, right? Like we were raised in a certain way. We were raised with a certain lens. And so it oftentimes isn't the child themselves that's responsible. It's the distress that's created because of a misalignment between my strengths and the way my brain works and what you expect from me based on your experience and kind of your understanding of this. So a lot of it can be sort of helping kids and families work out those stress points. And so helping parents think about different ways to structure that's supportive to kids on the spectrum, creating those routines that feel good, the warnings. I mean, there's lots of like little things that we use. But I think the ultimate thing is really creating that conversation between kids and parents or parents and teachers or kids and teachers for this is the way my brain works. This is what I need. This is what's going to help me, and trying to find those points that we can offer them some accommodation, some support, and then kind of promote their functioning that way.
If you are a therapist that's interested in like really specializing with this population, is there like a modality or some sort of specific style you would recommend, or not necessarily?
Not necessarily. I think there's been a lot of debate in the therapy world recently about certain modalities. ABA is one. So if people are familiar with ABA, applied behavioral analysis.
And this is new information for me. So like when I was in graduate school, I remember we would talk about, ABA is best for autistic people. And then like it's Autism Acceptance Month as we're recording this. And so even just in my own research and own conversations, learning about how a lot of people that are part of the autism community really, they disagree with that and make it, I don't know a lot about ABA, but that was new information for me.
Yeah, I mean, ABA is very much a behavioral model, and I think the backlash to it makes a lot of sense.
What is the backlash? Do you know?
It's about, instead of the world being okay with the way that my brain works, it's reliant on me to change me to meet the world's demands, to meet the world's sort of expectations of me, instead of recognizing that I have my own brain that works my own way, and that is okay. And you, as a part of, my system, have to work with me in that. It is all reliant on the individual with autism changing the way that they interact with the world. And it can create a lot of distress. And some of the backlash around it has been that it creates some shame, some guilt if we're not able to, or we don't want to change to meet other people's expectations or to function in a way that would be quote unquote typical, that it does more sort of harm. And I think in the crudest form, I've heard it described as dog training, right? Like it's this kind of way of doing it, instead of really having a conversation about individual brain functioning, how your brain functions, what the distress points are, what the strengths are, how can we foster this real like self-love and self-advocacy for what I need and how I greet the world. And I also think, ABA, we do it with kids and we do it for compliance. And we love compliance in kids, right? And then as we get to be adults, we laud people that think outside the box or do things different. Or, you put that on resumes, right? Like, oh, I'm a creative thinker who comes at problems from a variety of directions. And in kids, we're like, no, please don't do that.
Sit down and be quiet.
Right, exactly. Yeah. So it's a shift in how, and I talk to parents a lot about how the adult world is very much more forgiving of neurodivergence. You pick careers, you pick jobs, you pick experiences that meet your brain's needs, and we expect all kids to fall in line. And so the backlash of ABA is that I don't need to fall in line.
This is such a good segue into just the medication world then too, because should we be medicating just all of this kind of lends to I think a similar debate. And so I'm curious your thoughts, Dr. Garber.
Yeah. Before we dive into meds, the only thing I was going to add, Kelly, that was fabulous was just this relationship with school, which you touched on a little bit, but it's we want our kids to fit in this box of school and function well. And this is where I see a lot of my kids with autism really struggling. And so it's figuring out how do you really identify what the pain points are at school and really advocate for them, and teaching parents to advocate for them, because not every kid is going to fit that model. And so from my perspective, that's, I spend a lot of my time talking about that.
Hard.
How do we get school to
function better? I have an autistic teen that I see in therapy, and I mean, they are struggling in school. It's the last, month, 6 weeks of school, and they're struggling. And it's like, gosh, how can we be better advocates? How can we, it's so tricky.
Yeah, but then with meds, I think, the approach is similar to some degree, is that we don't have meds for autism, for example, I mean, there's one caveat to that, but yeah, we don't medicate the social deficit challenges, the restrictive interests, those kind of typical hallmark things of autism. We don't have meds for that. And so, obviously a lot of psychoeducation about that. But what we do use meds for is identifying what are these comorbidity challenges, right? What are the things that we see that go along with autism really commonly, like anxiety in childhood or ADHD. And we can use meds to try to help those functioning points, so we can help support a kid to feel better and function better, while they, learn their, ways to cope and do therapy and build their social skills and things like that. But, really identifying and figuring out if there are these kind of co-occurring disorders that need treatment.
Yeah, so much of your initial role with families and with kids is probably just kind of taking a step back and saying, okay, you have this overarching diagnosis, but what are these other smaller pain points?
Yep.
What about anger issues or other types of behavioral concerns?
Yeah, so the one caveat to the med discussion is that we do have 2 medications that are indicated for basically aggression or agitation associated with autism. So in really severe cases where kids, have difficulty controlling their behaviors and or have a lot of anger and irritability, we do use these two medications specifically called neuroleptics, atypical antipsychotic or neuroleptic medications. And they both have very good evidence basically for lowering kind of that degree of agitation and aggression. They both come with fairly significant side effects. So it's always a discussion with families, like what are the pros and cons of using meds and how do we weigh those risks and benefits. But usually by the time we're having that discussion, it's because behaviors are pretty significant. So.
Oh, interesting. And so oftentimes you're seeing kiddos that have like symptoms of ADHD, anxiety, anger, any other sorts of things that I feel like we're missing from a medication standpoint?
Yeah, I mean, you can see the whole spectrum of mental health occurring in people with autism. So, yeah, I do my assessment and my differential kind of the same way I would for any kid with or without autism, and make sure that we're screening for all those things, any type of anxiety disorder, depression, even, in rare cases, of course, like bipolar or things like that. But, kind of making sure that we're checking all those boxes and looking for anything else. But
Interesting. No, that's so helpful. So then how can therapists and prescribers work together? I mean, I know Ellie is nice because we have prescribers and therapists here, so we can just like reach out to one another or, do internal referrals pretty easily. But like in general, do you often talk to therapists that your clients are seeing? How does that look? What does that look like?
Yeah, I mean, certainly, I mean, it's great to collaborate with the therapist, and sometimes it's helpful to, like if you're working with a kid for a while and you're wondering like, oh, maybe, I wonder if this kid has autism, and, it hasn't been diagnosed, they haven't done testing, and it's been a little bit on my radar, so cases like that, I find it really helpful to reach out to the therapist and say, what do you feel like this is, maybe part of what's going on, or, even trying to identify those comorbid, challenges. Like, are you seeing anxiety? Are they willing to talk about it, in therapy and not maybe in med appointments, So, I mean, collaboration is always good and helpful. And
yeah, I think, I think Dr. Garber's point about maybe families or kiddos being able to talk in therapy appointments in a different way that they can talk to a med management provider. I mean, I think there's a little bit of like MD anxiety, right? Like, I don't want to talk to my doctor about these things, or I don't want to question this person that I hold in really high esteem. But I'll do it to my therapist. And so then we can talk about that and say, like, they don't bite. They're really, they're interested in your experience. And so if you feel like something's off or not working right, or you feel like there might be a dosage issue, especially for kids who have been on the same medications for a long period of time, or they're starting to go through puberty, or other things that may impact kind of dosage and medication, things like that, encouraging parents to advocate to talk to their medication management providers. I think the other thing that I really have appreciated is understanding for myself some of the side effects and some of the difficulties. There are certain drugs that we don't want to all of a sudden stop taking. And so it's been really helpful to collaborate with med management around, especially with some of my teens or my pre-adolescents who can have these periods that they go through where they really resist taking medications because they don't want to be different. They kind of have this, like, I want my brain to function, and it does. It's just that it can help them be less distressed. And so I think there can be this rejection period that kids go through, but being able to kind of lean into medication management providers and say, like, what is the risk here? Or what should I be talking to my client about? Because I understand that maybe they're not med compliant right now. Or mom is having some concerns about that. So being able to say, this is really not a great idea for this reason or that reason, in a way, through an established relationship where you're meeting weekly or biweekly.
Exactly. I mean, we're seeing clients usually more often, and so that makes a lot of sense too. Okay, for my own selfish reasons, I want to go back to the school point and ask, like, how can therapists and providers really be at the table and helping to advocate for kids in schools that are maybe public schools, underfunded, don't have the resources to really help with their students with autism.
Yeah. I don't know. Does anybody have an answer to that? Anybody? It's very difficult because I think it takes resources. It takes time. It takes staff who are well trained and have a good understanding of kids.
And to be clear, it takes a release of information too. Sorry, keep going.
Make sure you get that. So I think it can be really difficult. And I understand the resistance too. When I reach out to a teacher or I talk to a teacher and it's like, yeah, you don't have 31 kids in your therapy session. Yeah. You're right, I don't. I don't have 31 kids in my therapy session. And I can't imagine trying to do that. That is just that there's a reason why I have one. I think again, it's the relationship, right? It's the relationship that you foster with the school, with the provider, with the parents, with the kid, that you can use, and starting with the understanding of what this looks like from a school perspective, and advocating for those things. I think I have seen more willingness, I think, recently from school staff to think about it differently instead of in terms of compliance and that kind of thing, and be able to think about individual brain functioning and needs and strengths and things like that. But it's a challenge because you don't have the resources oftentimes to meet this kid's needs. And it's not that the teachers don't want to. They would love to. They'd love to be giving this child additional supports in whatever way they can. But it comes down to qualifications and funding and a whole bunch of other things that we have no control over. That didn't answer the question. I don't have an answer to the question.
Well, and I was just going to say, too, like in my experience, I've had kids that I'm just thinking through, like, most of my autistic clients are really struggling with school. And so the idea of a therapist talking to my teacher is hard. Like, that they get angry at that. And I mean, this is an overgeneralization just to my clients, but like, because they don't want to lose that confidentiality, and they shouldn't. But I have been more successful in saying, I want to hear from your teacher about where you're struggling, and so that you and I can be like processing and working on this, or even just brainstorming ideas that might be more helpful. But yeah,
I think I try and go back to too, like, this isn't your problem. Like, if your school's not meeting your need, that's not on you, right? So how can I help you explain the way your brain works, advocate for yourself, use your parents, use me, use the resources you have? Because I think so many times kids feel like they're destined to fail because the system isn't set up for their success. And so being able to kind of come alongside them and say, like, look, this isn't your problem. It's not your fault that the systems are meeting your needs. I want to try and work with you to figure out how we can make it so that you can, at the very least, advocate for what you need, and like kind of take some of that pressure off of them. Because I think oftentimes kids and families, like parents too, to a large degree, feel like they are constantly responsible for somebody else's understanding. And that is really hard, and it gets really frustrating.
I don't know if you have any thoughts on this, just from like a medication management perspective.
Yeah, I mean, just the same ideas, right? Like, we can't fix this big system issue, but really, like, how do you empower the individual and the family? And so I, put a lot of emphasis on, like, being your own advocate, or the parents, taking on that role and educating them about, like, how the education system works and what their rights are and how do they escalate things if they feel like they need to, and, offering what I can, I mean, I write a lot of letters. I don't know if it helps, but, things like that. But, making sure that they know that, right, it's not their fault, and it is this big ugly system to fight, but there are steps that they can take and things that they can do to continue to advocate for their child. And also there's a lot of education choice in Minnesota too, good and bad, you know, but knowing like maybe this school is not the best fit. And, you know, sometimes you have to make that choice too. And that's can be hard to do, but you know, I've seen that make a big difference too. So knowing that, you know, you aren't necessarily stuck, but how do you, you know, kind of keep working on it?
What sort of letters do you write?
Just a lot of letters, just supporting, like, I mean, obviously, like, an IEP would be ideal for a lot of these kids. Now, that doesn't always happen, but, you know, trying to get a 504 plan, which would be, you know, encouraging accommodations for a medical need. And so I write a lot of letters supporting that. I write a lot of letters outlining very specific accommodations that, so if a kid and I can come up with a list together in clinic about here are the things that I feel like would be helpful. I will put that in a list with, you know, from your doctor, you know, give that to your school and hope that helps.
Yeah. I mean, I would imagine that the school would like having some recommendations. Maybe it's mixed. I don't know.
Yeah. I mean, it's mixed. Sometimes it works great and you see changes and, you know, things work better and sometimes it doesn't. So.
No, that's great that you're able to do that. I mean, I think that probably helps a lot with families and feeling like they're not helpless and that they have someone in their corner that can be recommending these things.
Yep.
That's actually a perfect segue into how can we come alongside families and support families that have autistic kiddos?
Educate, a lot of processing, a lot of, I think sometimes we forget that there's parents when there's an autism diagnosis and that they're going to have their own feelings and thoughts about that and what it means and the implications of that. I always recommend that if the child is in therapy, the parent is as well, either individually or family. And family can be done without the child. So like you can process, you can talk about, you can talk with your kid's therapist about discipline practices, the way that they impact them, how your child's anxiety might be impacted by this, that, or the other thing. And so I always recommend that it's never a solo journey for the child, that the child really feels like they have people coming alongside them that are learning with them. So the parents are learning too. The parents are getting their own support. The parents are changing some of the practices at home. Again, it's not all the child's responsibility to conform to what we believe they should or should not do. But it's a lot of times about working with parents to understand how this particular child's brain is different. I think it's really interesting because I have some families who have multiple children who are on the spectrum, and they work so hard because they have to develop this understanding of this child's brain and this child's brain and this child's brain. And it isn't that there's a one size fits all or they can use one technique across all of their children because they all have been diagnosed with autism, but it's very unique, right? And all of the challenges and all of the strengths are very unique. So I think just getting that support, positive support. And so there's a lot of like Facebook groups and a lot of other sorts of resources for parents. But the one thing that I talk to parents about is if it feels supportive, lovely. If it feels like you're being taken for guilt, like just like if you're not constantly feeling inadequate or you're feeling like your parenting practices are so bad because you're a part of this group that makes everybody feel this kind of guilt and shame, like that's not what we want for you, because it is hard. And so we want that collaboration and that support to feel uplifting and creative, and you can try some things. But ultimately, too, I think just centering parents around the relationship. Like your child's ASD, ADHD, anxiety, depression, bipolar, whatever diagnosis they have isn't the thing. Your relationship with your child is the thing. And sometimes those symptoms can get in the way of our relationship with our child. And so how do we support that?
Do you have any thoughts more about, or any other thoughts about support?
Yeah, I mean, I think Kelly said it all, but it's,
You're so
it's
eloquent.
I know. Yeah. But it's changing the expectation, right? I mean, it's learning about your kid, getting to know them, and being able to kind of meet them where they're at. And often that is changing the parenting approach, right? Like what, your best friend does for their quote unquote normal neurotypical kid is not going to work, necessarily. And so being able to kind of accept that and get support around it. And
do either of you have examples of times when you've worked with families to like change a routine or change something to kind of help support the kiddo? I mean, I guess the thing that just comes to my mind is like routine or discipline or something, but I'm curious if there's any other examples.
I think so. A part of it sometimes comes down to what feels best in their individual. The hard part about this, right, for all of it, is that what works this year may not work next year. And as your child gets older and has different kinds of, hormones or like friendship challenges or just a very typical developmental struggle, like this is going to look different. And so sometimes that can be sort of tricky. But I think what I try and do is help parents understand behavior as communication, right? Not behavior as opposition, not behavior as being some sort of outcry against my parents and their authority and disrespect, but my behavior is a communication tool. And often it's a communication tool of distress. And so my behavior is indicating distress in some kind of way. And what way is that? And then how do we change that? So if we're seeing, big tantrums around something, where's the distress? Like, is it the anxiety of having to shift from something that I wasn't done doing, right? Or is it having to do with the unpredictability of things? And like, I just really, with an anxiety brain, like to have things a certain way. If we can understand where those behaviors are coming from or what they're communicating, we're going to be more able to intervene today, but also 3, 4, 5 years down the road when the underlying kind of distress is different. And I think that also serves the relationship because I can connect with you as my child if I'm understanding your struggle. And I'm not saying, oh, you're just trying to be disrespectful, you're just trying to be oppositional. I'm connecting with the anxiety, the feeling, the underlying emotion. I think it's really tough for kids because parents because they want to fix, right? They don't want to see their kids in distress. They don't want to see their kids having challenges at school or feeling like a failure or not succeeding socially. So in anxiety, they try and do almost too much. It's like, okay, just slow down. Like, let's understand what's happening here first.
No, I appreciate that. That's really powerful.
So I could give you an example of a case that I've had that follows along that
I love
line.
it. I love examples. Yeah, this is
so
great.
This was a middle school kid that I've been working with for a couple years, and through COVID they were home, and then all of a sudden there was this expectation to go back to school, and they did not want to go back to school, and so then every day it was huge tantrums, tons of anxiety, what appeared to be depression, suicide threats, home was miserable for parents, home was miserable for the kid, we're meanwhile like trying all sorts of medications, like, can we treat this anxiety, this school avoidance, this anxiety piece, fighting, things are not getting better. And eventually, and it took, kind of acceptance on my part and acceptance on the parents' part, like, maybe going to school, not going to school is okay. Like, maybe you shift and you do homeschooling and you change the expectation, right? And you change, maybe the idea in your mind of what was normal and expected for them to achieve. And all of a sudden, as we've made that shift, the kid is doing tons better and they're not anxious and they're off meds now. And home is a happier place for parents. It's a happier place for the kid. And so it's like, it just took us both, for myself too, like making that mind shift about like what is expected, what is normal, and what the kid was capable of doing right now. And so it I think, you know, for me to be able to step back too is just as important as the parents, but it's what made the difference.
That's a great example of just, you know, breaking down some of the expectations that we hold and even just questioning those. Like, why do we hold these expectations, or why? I mean, not to say that like expecting your child to go to school is a bad thing, but at the same time, it is like
for most kids, that is good and normal expectation. And that's something I advocate for. You know, I don't want anxious kids, you know, being able to skip school, because that doesn't work either. But, you know, for this kid with autism, it was a different story. And so it was important to be able to make sure that part of the puzzle was, you know, front and center in my mind, not just treating it like anxiety and school avoidance or opposition or, you know, a kid that just was, you know, having tantrums and being a problem for their parents, because that's not what it was. So,
I mean, it's behavior is communication, right? So, and I think there's this, I don't know why adults do this, but they're like, I always feel like somehow kids' behaviors are out to get them.
Oh, yeah.
Like they're like personal attacks. And so I think I see that with schools too, where I had a kiddo who was struggling in school, and the idea was, well, can they go to the resource office or the counselor's office? And it's like, great, but that's just reinforcing that they don't want to be in class. And I'm like, yeah, but it's also reinforcing that they know how to control anxiety, right? That they can excuse themselves and leave class and recognize that they're having an anxious moment and that kind of thing.
I mean, and how often do we need to teach adults to take breaks?
And I've talked to parents about that too, which is just we're allowing our children to do something that we very naturally do, which is, this is too much for me, I need to separate. And as an adult, the world gives you that freedom and gives you that space to do it most often. And for kids, it's seen as some sort of slight against humanity, right? Like, oh no, you mustn't. And this is a kiddo who is able to work back into being in the classroom almost full time.
That's amazing.
But because we understood it and we didn't see it as being a personal attack or threatening to they're doing just fine. We're able to work. And I also think it says to the kids too that people are willing to work with me. Like they're willing to see this and to feel it's valid and my struggle is real. I see so many kids across the diagnostic spectrum that just are trying so hard to have adults take them seriously and believe that their struggles are legitimate. And so I think just anything we can do to help kids feel that is helpful.
This has been so good. Thank you both so much for joining. Do you feel like we're missing anything before we, or any other last tips or thoughts you want to share?
The meaning of life. I think we're in kind of a crossroads in understanding particularly some of these neurodevelopmental, neurotypicality kind of areas, and starting to kind of reject it as being a personal problem and starting to accept it more as individual diversity in the way that we think about things and the way that our brain works. And I'm hopeful that a lot of the systems will eventually, and we know that systems take time to change, but I think I've seen more willingness to be open to that idea. And so I'm really hopeful that we, as therapists and as, you know, treating professionals, can support our families and our kids in that way too, and challenge ourselves, like Dr. Garber said, to think differently about situations and not think about this as a deficit. And I've even started writing that in assessments, right? Is I'm not treating the ASD, I'm not treating the ADHD, I'm treating the underlying anxiety that those things cause. But this is not something to be treated. This is the way your brain works. And so taking a different perspective shift.
You both are so amazing. I just love learning from you. This is great. Awesome. Well, thank you so much for joining. And
thank you.
We'll see you next week.
All right.
Thank you.